The Centers for Disease Control and Prevention has reported that a new variant, BA.5, is now the most dominant strain of COVID-19. They reported 31,000 people across the United States who are currently hospitalized with the virus, with admissions up 4.5% compared to a week ago. Well, for more on this story, we're joined by Global Health Advisor Clinical Governance, International SOS, Dr. Chris van Straten. Dr. van Straten, good evening to you. Thanks for your time. Firstly, what do we know about this BA.5 and how different is it from the other strains of COVID-19 that we've had?
Good evening, and thanks for having me on the show, and excellent question. BA.4 and BA.5 have been around for several months, and if you recall, we had BA.4 and BA.5 in South Africa. It was the end of April, beginning of May, and we were able to raise the alarm, note the differences, and we had quite a small wave, and we think that's because of vaccination and previous infections. So we've got a lot of antibodies in South Africa. It is now, as you correctly stated, in parts of America, the numbers are rising, the hospitalizations are rising, and we think that is a function of their dynamics, perhaps not as highly vaccinated as they could be, and people perhaps not taking it as seriously as perhaps they should.
So any particular concerns then for a country like South Africa?
So interesting, I'm still concerned about COVID. We're not out of the pandemic. And for those at risk, so people who are pregnant or someone who's immune compromised on chemotherapy or has a rare autoimmune disease, I'm worried about those people. And I want to make sure we keep each other safe. So I've had my vaccine. I've had my booster. My wife's also a doctor, and I've got a mum who's frail and elderly, and I don't want her getting severely sick. So I've made sure that we're boosted and she's boosted. And if we're in public places, I'm still masking and I'm still making sure I really wash my hands and have good ventilation.
Do you foresee a situation, Dr. van Straten, where things like travel advisories may come under consideration, especially whenever we have a new strain of the virus?
It's a really good question, and at the moment we don't know yet, and obviously we're hoping not. But what we are concerned about, the more people that get infected, the more new variants we can and will see. And that's really important. And all of us can play a role in distancing, hand washing, masking when needed, and getting vaccinated and boosted. Because if we get a new variant, and you would have seen in the news, there's a new variant in America, and they're concerned that this could be more infectious and perhaps cause more severe disease. And if that happens, yes, you will see restrictions coming again. So the onus here is one, we've got to keep updated and keep repeating the core message. We can all play an important role. Thank you.
Are there any particular concerns or issues that employers need to be taking note of?
That's also really important. And I think the key thing there for me pivots around, not only have we seen this upsurge in BA.5 in various parts of the world over the last 2-3 weeks, we've also seen the surrounding misinformation, those wanting to cause harm by spreading misinformation, spreading false news and fake news. So please, for businesses, for all of us to protect ourselves, make sure you've got a trusted health partner. Make sure you're getting information from reliable sources. And then secondly, interpreting that data and sticking to the basics because they work. And the things that work, it's good ventilation, it's getting your vaccinations, it's masking when required, and being considerate to others. And take those steps and you can make a big, big difference. Thank you.
Dr. Chris van Straten, let me thank you for your time tonight on The Pulse.